Hello, Isama here, showing you how to use C.A.R.E.S on ImageTrend. C.A.R.E.S stands for the Cardiac Arrest Registry to Enhance Survival. Using the C.A.R.E.S data dictionary from 2013, we've built in the elements into ImageTrend. The C.A.R.E.S data dictionary is a document that reviews and explains every C.A.R.E.S data element in the EMS, hospital, and CAD datasets. It is designed to be a reference tool for participating agencies. The development of the dataset and dictionary include the NUMSIS and UTSTEAM templates. Every C.A.R.E.S element that will be exported will have a C.A.R.E.S element number next to it. On our first tab, under Run Info, Incident Info, you'll notice our first C.A.R.E.S data element is C.A.R.E.S 15, which is the incident number that is assigned, and this cannot be left blank. Scrolling down, you'll notice C.A.R.E.S 25. C.A.R.E.S 25 is if CPR instructions were provided by the dispatcher. It's either yes, no, or unknown. Under the EMS Personnel tab, we ask that you proceed as normal and enter in your crew members. Under the Incident Address tab, you will notice C.A.R.E.S 1, 2, 3, 4A and B, and C.A.R.E.S 18. Here you will enter in the street address or the best approximation of where the patient arrested, the city, state, and zip code of where the patient arrested. C.A.R.E.S 18 is the type of location for the address given. All of this may allow for a greater understanding of high-frequency arrest locations that may be targeted for prevention or response programs. Under the Response Information tab, enter in your values as you normally would. Under the Patient Info tab, you'll find C.A.R.E.S 64. It's the date and time you arrived at the patient. C.A.R.E.S 5 and 6 is the patient's first and last name, if available. If unknown, it should be labeled as John or Jane Doe. Patient names are essential for ensuring accuracy in locating outcome information from hospitals, and it is protected in confidence. Once the individual C.A.R.E.S record is completed and verified with matching hospital data, the patient name and date of birth will be scrubbed from the registry and de-identified for the record. C.A.R.E.S 9 is the patient's date of birth. C.A.R.E.S 7 and 8 is calculated from the date of birth or best approximation. It is measured in units by which the age is documented. C.A.R.E.S 10 is the patient's gender. This may be an important risk factor for cardiac arrest and resuscitation intervention. C.A.R.E.S 11 is the patient's race. This may be an important risk factor for patients. Under the Patient Address tab, there are no C.A.R.E.S elements, and we ask that you proceed as you normally would. Under the History tab, you'll find C.A.R.E.S 12. C.A.R.E.S 12 is your patient's past medical history. You have multiple choices here. Pick the ones that are appropriate for your patient condition. C.A.R.E.S 13 is Other Past Medical History. Other applies to other chronic diseases that are known but are not classified by the existing choices. Under the Allergies tab, there are no C.A.R.E.S elements, and we ask that you proceed as normal. Under the Medications tab, there are no C.A.R.E.S elements. We ask that you proceed as normal here as well. Under Patient Physician, Closest Relative Guardian, and DNR, there are no C.A.R.E.S elements, and again, proceed as normal. Under the Assess and Treat tab, and Chief Complaint, enter in the primary and secondary impressions. Skipping down to cardiac arrest, you'll notice C.A.R.E.S 20. C.A.R.E.S 20 indicates if the patient arrested before or after the arrival of 911 responders. Once we click yes, it opens up a C.A.R.E.S tab. If no C.A.R.E.S tab will appear. So if the patient is not currently a cardiac arrest patient, you would click no. As you can see, the C.A.R.E.S tab now turns red. In the C.A.R.E.S tab, the first two C.A.R.E.S element that you will see is C.A.R.E.S 14 and 35. It is the date the cardiac arrest occurred. C.A.R.E.S 16 is the first responder tab. This is the personnel who will respond to the medical emergency as part of the team, but they are not a transporting agency, and they are also not a bystander. C.A.R.E.S 19 is arrest witnessed by. Please choose from the following. A witnessed arrest is one that is seen or heard by another person. C.A.R.E.S 20 is if the patient arrested after or before the arrival of 911 responders. C.A.R.E.S 21 is cardiac arrest etiology. All cardiac arrest of non-traumatic etiology must be entered into C.A.R.E.S. If minor trauma may be present but not likely the cause of the arrest, cardiac etiology should be considered. The selection of other should only be used if the etiology is known but not one that is available in the options. C.A.R.E.S 22 is an indication of attempt to resuscitate. Patients with signs of obvious death where the initial efforts have been initiated will not be considered as attempted resuscitation. This includes cases where first responders may start CPR, but upon arrival of ALS, efforts are ceased due to obvious signs of death. C.A.R.E.S 23 is who initiated CPR. This identifies the initial person to perform CPR. If not initiated, select not applicable. Layperson medical provider is a physician, RN, paramedics who are not part of the organized rescue team. First responder is non-transport and includes PD. C.A.R.E.S 24 describes the type of bystander CPR. This field allows for the categorization on the type of bystander CPR and will provide information on the survival rate of each method. C.A.R.E.S 26 determines the incidence of AED use prior to EMS arrival. C.A.R.E.S 27 identifies who initially applied the AED during the resuscitation. C.A.R.E.S 28 identifies who was responsible for the first defibrillation of the patient. C.A.R.E.S 30 is the first monitored arrest rhythm. The first monitored rhythm when the monitor or AED is attached to the patient after a cardiac arrest. If the AED has no display or no recording device, then it should be classified as simply unknown shockable or unknown unshockable. C.A.R.E.S 31 is sustained ROSC. Return of spontaneous circulation, or ROSC, is defined by C.A.R.E.S as a restoration of palpable pulses or a measurable BP. Sustained ROSC is determined when chest compressions are not required for 20 minutes straight and signs of circulation persist. C.A.R.E.S 32 is hyperthermia care, and if it was provided in the field, if measures were taken to reduce the patient's body temp by means of external cold packs and administration of cold IV fluids. C.A.R.E.S 33 is the end of EMS cardiac arrest event. This is the reason why CPR efforts were discontinued. C.A.R.E.S 34 is the time that ROSC was achieved. ROSC is defined by a palpable pulse and a measurable BP. C.A.R.E.S 36 is the date and time of the first defibrillation. This includes both the AED and the monitor. C.A.R.E.S 37 is the first CPR, date and time. This is CPR performed by anyone. The next three C.A.R.E.S elements were written out as a reminder to select and place in your procedure section of your EPCR. C.A.R.E.S 38 is the mechanical device, and it indicates if a mechanical CPR device was used during resuscitation. C.A.R.E.S 41 is the impedance threshold device, or ITD. This device allows for positive pressure ventilation, but prevents inspiration caused by negative pressure within the chest. C.A.R.E.S 44 is the 12-lead performed. Perform a 12-lead when applicable. This may be performed on a patient post-resuscitation and can assist in identifying patients with possible MIs. C.A.R.E.S 58 is the first responder dispatch time. In the additional cardiac arrest detail tab, these choices are NEMSIS required fields and are different answers than C.A.R.E.S elements. Due to this, there will be minimal duplication. Under the Treat and Response tab in Procedures, one of the first C.A.R.E.S element you will run into will be C.A.R.E.S 43, which is vascular access. It asks if any devices were inserted into a vein. IO also may be used here. The next C.A.R.E.S data element you will see is C.A.R.E.S 40. Under the Procedure tabs, you click Add. Under the Procedures, click the Advanced Airway as appropriate for your patient condition. Once selected, you will notice that Airway Confirmation tab turns red. Click Add, and you will see C.A.R.E.S 40. Fill in this tab completely, not forgetting to add in the date and time of placement. And the last C.A.R.E.S element we're going to talk about is C.A.R.E.S 42, which is the drugs administered during resuscitation. Under the Medications tab, you click on it and open it up. Here you will find C.A.R.E.S 42. Enter in the medication as appropriate for your patient condition, select it, and enter in your medication dosage. Click Click OK, and everything has been entered. The last thing we want to show you is that we've created a power tool for cardiac arrest to help facilitate through the process of the EP-C.A.R.E.S system. Use it at your convenience. We hope that these tools help identify any key issues, and thank you for listening.